chapter.
Okay, so we are looking at fibrous and stromal tumors. So Shane, what do you see here?
Well, I wasn't sure if we're still in the chapter. I know it's like mucin.
Yeah, so mucin, and so if you have a focal glob of mucin, what would you call that?
Maybe like focal mucinosis.
Like focal mucinosis. And focal mucinosis, which is also a cutaneous myxoma, you know, they overlap. It depends how many mucoblasts are in there, which it is. Any associations?
Maybe the name and lamb.
Yeah, name and lamb, which is all Carney's complex, would be the important thing in terms of associations. Very good.
So this is
I'm going to get rid of some of the dirt.
It's got like a spindle neoplasm with some
Spindle neoplasm, big or small?
very big.
Very, very big.
Kind
And
of coming off of the epidermis. There's some.
so describe the overlying epidermis.
There's some. There's a little acanthosis, but not as much as I expect for like a DF. There's no follicular induction that I can see.
So there's no follicular induction, but there is acanthosis. How often do you see acanthosis in big tumors of various sorts?
It's not very common.
Yeah,
right?
normally you would have effacement, right?
On the other side, if you look to like, I guess it's my right, I don't know if it's your right, that looks more effaced and looks like it's more destroying the DJ on that side than like the other cut that's mirroring it.
But, you know, using clues that are on the slide, most big things face the epidermis. This has acanthosis. So what kind of fibrous tumor do you know of that does acanthosis?
I mean, Dermatofibroma.
So your first question is this some kind of DF? Mm-hmm. Because it's a big honking fibrous tumor, and yet it has acanthosis instead of effacement, right? So you'd say, you know, could this be some kind of DF? So then you start looking at it, and over at this side you have pyramid-shaped epithelioid cells. So it's kind of an epithelioid histiocytoma over there, and other areas it is kind of a big nondescript fibrous tumor. Some areas you see some collagen trapping. You also have some other clues, like you have a ringed siderophage. Very good. So ringed siderophage is pretty much pathognomonic for DF. So big DFs, you may have to look for some of the clues. They may not have very prominent collagen trapping.
In that other cut through, where it just is that just artifactual, like on the other side, where it's like not this cut, but there's to that one, like at the top at the dermis, like there's just like that destruction in that area that you're seeing. Is that
so
this looks more effaced to me over here.
Even there, if you look if that were normal epidermis, you'd have reedy pegs with dermal papillae that go up to about the tip of the arrow. Mm-hmm. This is a plate-like acanthosis, but it's still thicker than epidermis would normally be. Okay. So it's lost its reedy pattern, but plate-like acanthosis is something DFs can do. So when you're dealing with a big DF, so big freaking DF, BFDF, some of your remaining clues include acanthosis, ringed siderophages. Those are things that are probably more common than collagen trapping. So, some of the clues become less helpful, others remain as helpful. Okay.
So, we have some pretty bland, spindled fibroblasts with a lot of collagen around them. They
Okay.
look like that fibromyitosis look to me.
So what about it looks fibromytosis?
Like they are skinny and all going in the same direction and
So,
wavy.
so they're skinny and beyond wavy, they're more like a corkscrew. And if you flip down your condenser, both the collagen and the nuclei have the same kind of corkscrew configuration, suggesting one gave rise to the other. So you have corkscrew fibroblasts that made corkscrew collagen. And so you are absolutely correct, fibromytosis. One of the other clues to fibromytosis is they tend to have less densely cellular and more densely cellular areas, whereas things like a desmoid tumor are evenly hypercellular across the whole field. The fibromytoses that we tend to see in skin, like Lederhosen, Dupuytrens, Pyrenees, those have hyper and hypocellular areas. Very good. Okay.
So you have a very acanthotic epidermis and a busy dermis. So think about DF possibly.
So very acanthotic, busy. Acanthotic epidermis over a busy dermis makes you think DF. You've got follicular induction, which helps. You have some collagen trapping at the sides. And you have more cellular and less cellular, more sclerotic areas, which occurs in dermatofibroma the same way it occurs in cutaneous fibromatosis. So, whereas DFSPs tend to be, being a sarcoma, tend to be hypercellular across the field. So sarcomas come in two variants. Translocation sarcomas tend not to have a lot of atypia, but are very hypercellular. So translocation sarcomas are things like DFSP. So the cells aren't going to be very atypical, but you'll have just lots and lots and lots of nuclei.
So is that a sclerotic DF?
So that particular one you could absolutely call a sclerotic DF.
Let's see, a large tissue, kind of like varying areas of cellularity, kind of this blue.
And what color blue?
Kind of a blue-gray.
Kind of a blue-gray, and you
Mixoid.
associate that with what kind of mucin?
You see that cartilage?
Yeah, or any sulfated mucin. So sulfated mucin tends to be that blue-gray, the most common one being chondroitin sulfate, which is cartilaginous mucin.
This makes me think of the... Well, I guess, so... it's more myxoid, fibrous areas, could be like a fibrous hematoma of infancy, or nodular fasciitis, perhaps.
So those have mucin, but usually not sulfated mucin. So this really looks sulfated. It looks more cartilaginous. So you think, what kind of fibrous things are on a cartilaginous spectrum.
Like an endochondroma.
So, enchondromas, certainly are cartilaginous, but tend to occur in bone rather than skin. One of the hints when you look at the cells here, a lot of them look almost like sebocytes where they're multiloculated. That's what's called a phycoliferous cell. So if you had an axial tumor, commonly presacral, differentiating towards the primitive notochord that then metastasizes and you get it all over the place in skin, something that is an oma that came from the notochord, you'd call a chordoma. So, the chordomas are primitive tumors with cartilaginous and fibrous differentiation. And clues are you have a sulfated gray-blue mucin. Looks like cartilage. When you see that colored mucin in skin, you think of things like mixed tumors, chordomas, parachordomas. Basically, you can break it down to two big buckets. Myoepitheliomas, which are everything from mixed tumor of skin to parachordoma, and true chordomas, which are more likely to behave malignant, which are, they start as deep axial tumors but commonly metastasize to skin, which is where we see them.
Are myofibromas in that category?
So,
Like the juvenile myofibromas?
myofibromas are not. So they get a little, you're commenting because the blue in a myofibroma looks a little similar. It's not really mucin, it's collagen that gets that hue. But the myofibromas they're not grouped with the myoepitheliomas. Okay.
So, looking at it, you have a pretty large, busy dermis, some overlying acanthosis. So now the DF would have to be in the differential. You have some collagen trapping at the periphery.
Yeah, so you have beautiful collagen balls at the periphery that you can see at scan. You have overlying acanthosis. You have sebaceous induction. You have hypocellular and more densely cellular areas, and it goes into the fat in a lacy fashion. That's all good for DF. Very good.
So this looks like a small papule. Very cellular, but really overall, I think it looks pretty benign.
How would you characterize the cytoplasm of the cells?
Vesicular.
Yeah, kind of foamy,
Mm-hmm.
right? Like xanthoma cells. So the first question is it just a xanthoma? It is trapping a lot of collagen. So, differential would be xanthoma or dermatofibromas, which can lipidize. So you can have lipidized DFs that have xanthoma cells, or it could just be a xanthoma. One of the, you can look at it immunohistochemically, but the easier thing to do is usually look at the patient's lipids. Do they have a reason to have a xanthoma, or is this one solitary lesion that's more likely just a dermatofibroma?
The pattern in the bottom of this one's more like a DFSP to me.
So pattern like a DFSP, so explain how it's like a DFSP.
It has a storiform, cartwheeled appearance, and it's infiltrating the fat in a lacy-like
So storiform infiltrating fat, where it replaces the fat and lipocytes are left in almost single file rows. It has a true woven storiform pattern, and when you look at the nuclei, they alternate. So one fascicle is skinny and dark, the next fascicle is gray and epithelioid, skinny and dark, gray and epithelioid. Same disc-like nucleus viewed either on edge or on face. So it's a disc-like nucleus that in one plane of section appears oval and pale, and in the other plane of section appears skinny and dark because it's a flat disc. And that's morphology pretty unique to DFSP. One of the other things you can do is you can polarize these. DFSP tend not to have a lot of polarizable collagen in them, whereas DFs tend to trap polarizable collagen. So that's one thing you can do without ordering a stain that can help.
This has the overall architecture of a DF, probably the aneurysmal DF.
So it has big aneurysmal vessels, has big-time collagen trapping with collagen balls, and then you would expect to see ringed siderophages if this is an aneurysmal DF. And so you look for areas of brown to see, do you have wreaths of nuclei with the brown around them. If you have ringed siderophage, then that probably is just a variant of a dermatofibroma. DFs come in endless variation.
So stem cell proliferation.
And what's happening there?
It's like there's the collagen.
So it's got little lacunae with little haversion canals. So that's all osteoid.
Okay.
So this is a fibrous tumor forming bone, which is not uncommon in fibrous tumors. So, it's a weird kind of fibrous tumor. It's myxoid, it's got ropey collagen and maybe collagen trapping. So go back to some of the basics. It's a fibrous tumor. The overlying epidermis is A, thinned and atrophic, B, acanthotic.
B, acanthotic.
Do you know any fibrous tumors that cause acanthosis?
DF skulls.
Yeah, so your first question then is this some kind of weird variant of DF? So do you know any variant of DF where your cells, instead of being spindled, are epithelioid or triangular, pyramid-shaped? Like an epithelioid histiocytoma. So that's, take the easy way. If it's a good-sized fibrous tumor, look at your epidermis first. If it's anywhere near the epidermis will react appropriately. Effaced from most tumors, acanthotic from a DF. So if it's a pretty decent-sized fibrous tumor close to the epidermis and the epidermis is thick rather than thin, your first question is, can I fit this into any kind of DF category?
So there are these nice fibroblast cells, almost looking like radiation fibroblasts in the dermis.
So big, huge, atypical cells that look like radiation fibroblasts. So
I think this is the infantile. There's something that I'm supposed to know with that. I don't remember which one that has those.
So what kind of fibroma would have such big pleomorphic nuclei? A pleomorphic fibroma. So pleomorphic fibroma has no mitosis, has big, ugly, radiation fibroblast-looking nuclei, but they are just randomly peppered across the lesion. So big radiation fibroblast-like nuclei, but just randomly peppered across the lesion. So is there any way this could be a translocation sarcoma? What do those look like?
Those are more bland looking. They don't look as.
Those are bland and hypercellular,
Yeah.
right? So you have sarcomas that come from mutations, you have sarcomas that come from translocations. The translocation sarcomas are, very uniform hypercellular. This obviously looks nothing like that, right? This is a bland looking, at scan almost looks like a skin tag, but it is just peppered with these huge atypical cells that look like radiation fibroblasts, but there are no mitoses whatsoever. That's good for a pleomorphic fibroma.
So you have a pretty large chunk there with a lot of blood, it appears.
So a large chunk, lots of blood.
They look pretty evil potential cells there with two populations. Concerned about epithelial sarcoma.
So tell me about this kind of, what do you see here?
Is that a multinucleated cell?
It is a multinucleated giant cell. Is that typical in epithelioid sarcs?
No.
No, not so much, right? So, and what kind of giant cell? Are they all at the periphery, like a...
distributed, so that's like a osteoclast.
So they're randomly distributed. They have a pretty dark pink cytoplasm, and they are glomming up to adjacent cells and molding to them. So you're absolutely right, that looks like an osteoclast. So it's an osteoclast-like giant cell. And in fact, we're seeing tons and tons of osteoclast-like giant cells.
So like a giant cell tumor?
Like a giant cell tumor. So osteoclast-type giant cells you'll see in skin in basically two things. One is osteosarcoma, where there'll be a tibia and there'll be usually bad bone formed. It's not well-formed or mature bone, but it's a very immature osteoid. So bad bone, atypical cells would be an osteosarcoma in skin. Here, the nuclei all look pretty uniform. There's not much pleomorphism. They just look like osteoclasts. There are just lots of them, and we don't see any bad bone. So this is probably giant cell tumor. Giant cell tumor commonly have blood and commonly have hemosiderin. So the hemosiderin really common. They tend to be pigmented clinically. Okay. Jess, what do you see here?
So mostly this looks pretty sclerotic.
Looks pretty sclerotic. Any patterning to it? Reminiscent of any Impressionist paintings?
Like Van Gogh.
Like Van Gogh's Starry Night.
Sclerotic.
So sclerotic fibroma, any associations to sclerotic fibroma? Cowden's disease. So it's relevant because of its association with genoderm. Okay. Evenly hypercellular throughout, or hypercellular nodules in a proliferation that's less cellular overall?
The latter.
The latter. So you think this is more likely sarcoma or something benign?
Let's say benign.
So something benign. Where do you think you are?
Deep tissue subcutis.
And what kind of
That's a big-
structure do you have there?
That's a big neurovascular bundle.
Pacinian corpuscle.
Corpuscle.
So Pacinian corpuscles are pressure sensing. It's going to put you like a palm or a sole. Actually, palm, sole, or genitalia are things that feel pressure. So palm, soles, genitalia are things that have Pacinian corpuscles. Anything that you know of that has hypercellular nodules and a fibrous tumor that would occur on palm, sole, and genitalia?
Oh, I'm kind of blanking.
Let's look higher at it. If you look at the morphology of the cells, how do they look?
Okay, that's kind of the corkscrew.
Kind of corkscrew. So any corkscrew proliferation that occurs in hypercellular nodules on palm, soles, and genitalia.
It's not Dupuytrens or...
Yeah. So, and you get full credit for Jeopardy because you phrased it in the form of a question. Dupuytren's, Pyrenees, later hose is palm, sole, genitalia, right? And they are nodules, so hypercellular nodules in a more fibrotic, less cellular background with corkscrew nuclei, corkscrew collagen.
So you have a large hypercellular operation. Is that a giant cell there?
It is certainly a giant.
Well, above it.
That is a multinucleated giant cell. And this is a giant cell. Yeah,
Right.
so you have both cells that are giant, and you have giant cells. And the giant cell does that look like an osteoclast, or what kind of giant cell would that be?
So I would say it's lining kind of the periphery there.
So they form a circle, a wreath,
Right.
and peripheral to the wreath, is it just normal cytoplasm, or is it clear and bubbly?
Clear and bubbly.
So what would be a lipidized,
Ring siderophant
or I don't see hemosiderin, but
or
a
two-ton.
like a two-ton giant cell, right? So two-ton giant cells. So it's something with two-ton giant cells, no hemosiderin in it that we're seeing. Two-ton giant cells and fibrous tumors, any particular ones? So you are, again, playing Jeopardy, and yes, you are correct, dermatofibromas do that. So they do rings. So they do ringed siderophages, but they also do two-ton giant cells.
Okay.
So two-ton giant cells we associate with xanthogranulomas, but also very commonly with dermatofibromas. So if it's a more fibrous tumor, dermatofibromas, and so you start asking, could this be a DF? Well, I see lots of two-ton giant cells, which DFs and xanthogranulomas have. There's certainly lots of collagen balls at the periphery. So I'm going to look for things like overlying acanthosis. What about these big, monstrous nuclei? Are there any sort of dermatofibromas that have big monster cells?
Yeah, with monster cells.
Yeah,
Dermatofibroma
it's
with
called
monster
dermatofibroma with monster cells. So the point is that these big, monstrous nuclei don't make it malignant. They're very common in dermatofibroma. They mean nothing. So in DF, what's your most common differential diagnosis? What would be the malignant differential diagnosis for a DF?
DFSP.
DFSP. And DFSP, what's its genesis? Is it its translocation? And so what would a translocation sarcoma look like? Would it have big, hideous, ugly nuclei? Or would it be very bland,
hypercellular.
uniform, hypercellular? So the differential is a translocation sarcoma. That's a uniformly hypercellular, pretty bland cells. Looks nothing like these big monster cells that you get in DF, so they don't scare you because your big differential isn't something with big ugly cells, right? It's something that's a translocation sarcoma that's uniformly hypercellular across the field. So you handled it absolutely correctly. You saw lots of two-ton giant cells. You said, well, that makes me think of JXG, but this is more of a fibrous tumor, so they also occur in DFs. And then you looked for your other clues of DF. You saw the collagen trapping. You saw those big monstrous cells, but you said, they don't scare me because I expect those in a DF, and I don't expect those in a translocation sarcoma. So you nailed the diagnosis. Well done!
Looks like a little angiofibroma.
So it looks kind of angiofibroma-like, but angiofibromas, do they tend to be this deep, or are they kind of up here?
I feel like more superficially.
Yeah, so it has cells, big stellate cells like a fibrous papular angiofibroma, but this is a deeper tumor in the soft tissue. But you said angiofibroma because there's a lot of ang here, right?
Mm-hmm.
There are lots of, so there's an angio to this. And then how about these cells? Do they have one nucleus or multiple nuclei?
Multiple.
Do you know any kind of multinucleate cell angiohistiocytoma?
I think that's it.
So multinucleate cell angiohistiocytoma, just very descriptive. The stellate cells look like the cells of a fibrous papule or angiofibroma, but it's a deep tumor that's kind of equally vessel and histiocytes, and the histiocytes are multinucleate and stellate. So multinucleate cell angiohistiocytoma, soft tissue tumor, equal parts ang and histio, and the histiocytes are often multinucleate, and the ones that aren't multinucleate tend to be stellate, like in a fibrous papule. So first looking at the edge, where do you think you might be?
Acral skin.
So acral skin.
Something about like the acral fibromyxoma.
Yeah, so digital fibromyxoma, acral fibromyxoma, superficial acral fibromyxoma, they're all synonyms. So superficial acral fibromyxoma is a fibromyxoid superficial acral tumor. So what would you call a superficial acral fibromyxoid tumor? You know, someone decided to call it a superficial acral fibromyxoma, right? Which is just very descriptive of what it looks like. And they tend to stain how? Usually CD99, CD34. Those are common things that we'll use for them. So they are CD34 positive, like DFSP is CD34 positive, but there are lots of benign things that are CD34 positive too, with superficial acral fibromyxoma being a big one. So it's superficial, it's acral, and it's fibromyxoid. So superficial acral fibromyxoma.
Definitely very myxoid.
Very myxoid. Why is it so full of blood vessels? Do you know anything that's an angiomyxoma?
Yeah.
So tell me about angiomyxomas.
I think you could see them in carnies. You
Ye-
can see myxomas.
Yeah, you can see myxomas, and the angiomyxomas come in two basic flavors. There are superficial ones, which are often kids, and those superficial angiomyxomas are totally benign. And then you have the vulvar ones in adult women that go under the name aggressive angiomyxoma. How do you think those might behave?
Probably aggressive.
Probably aggressive. They're kind of deep, infiltrative tumors. So they have these curvilinear vessels, and they're equal part angio and myxoid. So, again, very descriptive. They're angiomyxomas. Remember, the superficial angiomyxomas are benign, but remember, in the vulva, there are those aggressive angiomyxomas, tend to be adult women, very destructive, infiltrative vulvar tumors, and
Do those have any hints of being bad? Like, do they have pleomorphic cells or
no,
mitosis?
they don't.
Okay.
They don't. So they're very, very bland looking. They do not have high-grade atypia. They don't have that many mitoses. They're very bland, fibromyxoid with curvilinear vessels. So like a lot of things, clinical becomes absolutely key to diagnosis.
So acanthosis of epidermis, maybe even on maybe acral skin.
Yeah, so maybe on acral skin. And how would you characterize the proliferation?
Histiocytic.
Histiocytic, any particular color to the
Oh, they're like
histiocytes? So, and the background is kind of gray, like mucinous. So it's kind of fibromyxoid. Do you know any kind of superficial acral fibromyxoid proliferation?
It's like the one we just talked about.
Which is called a?
Superficial acral fibromyxoma.
Yeah, so superficial acral fibromyxoma. So if it's acral, that's probably where you're going with it. In other sites, if this were someone with multiple papules lining up in rows on the trunk, you might think of scleromyxedema. If it were someone who's had gadolinium and has a sclerotic type condition, you might think of nephrogenic systemic fibrosis. They have lots of overlap in histologic appearance. They're all CD34 positive. And so they're differentiated largely based on the clinical appearance. Okay. Small or big?
It's big. It looks like it's got like those pink squiggles, which are the elastic in there a little bit.
When you look at the cells, first off, it's loose. You have lots of these red things. What are the little red things?
Oh, those are the like actin. Right.
These are bright red, like erythrocytes.
Oh, okay.
So lots of extravasated erythrocytes. And if you look at the fibroblasts, what do they resemble?
Like culture.
Like tissue culture fibroblasts. And one of your assignments, if you haven't done it before, is to go online to Google Images and Google image tissue culture fibroblast, because the fields look just like this. Right? So it's very loose, it's myxoid, there's a lot of red cell extravasation, and you have tissue culture fibroblast appearance. So this would be nodular fasciitis.
I thought I saw what you saw.
I think
Those
it's blood
little-
vessels.
So, you often have little blood vessels, but they're not chicken wire pattern, arborizing. They sort of radiate outward in the nodule. It's myxoid, you have red cell extravasation, you have tissue culture fibroblast appearance. That's good for nodular fasciitis. So loose, myxoid, red cell extravasation, tissue culture fibroblast, good for nodular fasciitis. Anyone want to pipe in how proliferative fasciitis differs? Tends to trap collagen, infiltrate septi, and have ganglion-like nuclei. So, another entity that we see in skin, and you need to differentiate. Okay, well, unfortunately, we got a couple of air bubbles here. But let's look around the air bubbles and tell me what you got here.
Looks like a bunch of vascular spaces or lymphatic spaces, but.
So some of them are endothelial lined and are absolutely little vessel spaces. Others are probably xylocaine bubbles. So any fibrous tumor, anything that's hard or sclerotic, when you're pushing the xylocaine in, you can get little bubble-like spaces.
So if we delete the bubbles, the air, the brown, I guess you're making kind of an onion skin motion there with the pointer.
Like an onion skin motion around a follicle and around vessels.
Yeah. So like parts of it look like sclerotic fibroma or angiofibroma.
Yeah. Like, and I'd say maybe a little less starry night and a little more onion skin around vessels and fibrous tracts, like an angiofibroma, which is same as fibrous papule of the face.
So it looks like you have I think this looks like a scar.
Looks sort of like a scar. And why are you saying it looks like a scar?
Well, you have the collagen fibers that are going sort of east-west.
So you have, it definitely has an east to west configuration like a scar. Now, does scar usually leave all your adnexal structures behind sitting pretty?
No, they're not.
But this thing respects the adnexal structures. So it's east-west like a scar, but it doesn't ablate the adnexal structures. What would this very polite proliferation be called? A dermatomyofibroma. So dermatomyofibroma, they are corkscrew myofibroblasts, which is why it's a myofibroma, right? And they are east-west in orientation, but they respect the adnexal structures and don't replace them. A scar, you would expect your adnexal structures to be wiped out. Okay, David, take the easy way out.
Okay, well, with that, let's see, we have an acanthotic epidermis.
A big acanthotic epidermis. What kind of fibrous tumors do that?
Dermatofibroma.
Dermatofibroma. So I would ask myself then, could this be any kind of dermatofibroma? Does it have features of a dermatofibroma?
Yeah, I see some collagen trapping.
So you see collagen balls, collagen trapping, and it's lacy into the fat. That's okay in a DF. And then we're going to look higher power.
Looks a little.
I do see these huge 20-pound vesicular, ugly-looking nuclei. Should I be scared?
No, so some monster cells.
Yeah, and those are okay, right? So those are okay. Does DFSP, does that get those monstrous type of big, ugly cells?
Negative.
No, because it's a translocation sarcoma, right? So it would never look like that. But DFs do get those. Okay.
So, acquired digital fibrokertatoma.
Like an acquired digital fibrokeratoma. It looks like acral skin.
Vertically
Collagen is vertically oriented. You have stellate fibroblasts as you would in any angiofibroma or a fibrous papule, so you are correct.
Very focal papule here.
Little focal papule composed of
It definitely has collagen.
collagen
Almost little itty bitty collagen balls.
and
Doesn't have the overlying acanthosis or follicular induction surrounding it, though.
any pattern to the collagen around pre-existing structures like vessels or adnexal structures,
Kind of onion skinning.
kind of onion skin. So what might this little papule that looks like it's on facial skin be?
Fibrous papule.
Like a fibrous papule. So fibrous tumor and kind of palisades around these calcifying areas. Tends to occur in the aponeuroses.
It's just a variant of like Lederhouse.
So, well, maybe distant cousin, but the calcifying aponeurotic fibroma, again, very descriptive name. It's calcifying, it's aponeurotic, it's a fibroma, and it very characteristically has these palisades with calcification in the center. Often a little cartilaginous type change. Sometimes even bony type change in there. But a broad fibroma of the aponeurosis, palisades, central calcifications. So the calcifying aponeurotic fibroma. A lot of them have, fortunately, very descriptive names.
Kind of looks like synovial cyst.
Yeah, so big metaplastic synovial cyst. Tends to be fibrinous. They occur after trauma. They're pretty common in skin. And you get synovial metaplasia and fibrin. Big circular like that. Okay, from scan.
So acanthotic epidermis.
Acanthotic with a big tumor.
So maybe like DF.
So you think some kind of DF, and then you go higher. I see all these xanthoma cells. Are there any lipidized DFs?
Yes.
Yeah. They often have wreath nuclei, ring siderophages, or they can just have big xanthoma cells. There are lots of collagen balls off to the periphery. The proliferation of the fibroblast is leaping dolphins or curlicue rather than storiform, which goes with a DF as well.
There's that scar tissue in there.
Scar.
Keloidal, like collagen.
So is it bubblegum keloidal, or are they more just whorls and nodules within the scar?
Just whorls and nodules and scars. There's just so much of it that I thought we were getting into keloid territory, but that's not.
Yeah, but you don't have the bubblegum collagen, and so as the whispers implied, this was hypertrophic scar. Very good.
It's all
Okay, how about this one?
Aneurysmal DF.
So, how'd you jump right to that with this big black? I would have thought
T-shirt.
melanoma, right?
You'd be wrong. Tell a mistake.
And so
Don't let that brown fool you, Dr.
save me
E.
from myself. Why should I not go down the road of melanoma for this big brown nodule? Any clues?
Epidermis is a clue.
So tell me about the clue in the epidermis.
It's the acanthosis for giant.
It's
melanoma tumors,
acanthotic.
where you have more of a slam dip.
And then you
With
look
the-
at the brown stuff and flip down your condenser, and it twinkles at you and is refractile, so it's not melanin, it's hemosiderin. And so lots of hemosiderin in a DF, really common. Overlying acanthosis, well done.
So, kind of has like a herringbone type pattern.
So like a herringbone pattern. So herringbone would lead you to conventional fibrosarc. In a fibrosarc, all the nuclei in the herringbone, they're all equally dark and skinny. Are these all equally dark and skinny, or are they alternating fascicles of skinny and dark and oval and pale?
The latter.
So the latter, which would be characteristic nucleus not for a conventional angiosarc, but for
Or DFSP.
I'm sorry, I didn't mean angiosarc, I meant fibrosarc. Sorry about that. My bad. So not the uniform herringbone, all the nuclei skinny and dark, like a fibrosarcoma. This would be
More like a DFSP.
DFSP, where there are alternating fascicles are storiform woven, skinny and dark, alternating with oval and gray. Because it's a disc-like nucleus seen at right angles.
Shape, some little ectatic vessels superficially. They don't quite look like stellate fibroblasts.
They're not so stellate, they're more epithelioid, right?
Mm-hmm.
But it's superficial with ectatic vessels on facial skin. That's okay for a fibrous papule. More characteristically, they're stellate, sometimes they're epithelioid. It's okay. And I think we're out of time. So